I'm sure you've been tracking the numbers around COVID-19 as carefully as I have. There's been a small uptick in the number of new cases being reported on a daily basis. Plenty of people now worried about a third wave of the virus sweeping through our land. Well, Dr. Ridhwaan Suliman is a senior researcher at the CSIR. He tracks the numbers for us. Dr. Suliman, good afternoon to you. How significant is, it seems to be a small uptick, but how significant is this small uptick in new cases every day?
Good afternoon, Stephen. So, as you say, the increase that we are seeing is drastic, but it is significant because it's a change in the trajectory that we have been seeing on a national level in the leading indicators, that being of the confirmed cases as well as the test positivity rate. So, from the peak that we were at in the middle of January, the number of confirmed cases as well as test positivity rate was at a sustained decrease for over 8 weeks. However, over the last 2 weeks, we are seeing that has flatlined and shown slight increases. And this is being driven by localized outbreaks in certain regions. So what is significant is the change in trajectory and the fact that the virus is still with us. And if we don't remain vigilant and control those outbreaks, it could spread and become worse.
I mean, it's one thing to have 1 or 2 days with higher cases. There can be sort of weekend variation and different people, different reporting at different times. The problem is the longer trend. How long a trend do you need before you point to something and say we've got a problem?
Well, we have to monitor the trends quite quickly. As you say, there are dips over weekends. So what we look at is rolling 7-day average. And if we see an increase for about a week in the rolling 7-day average, that's when we need to trigger some alert. Also, we need to look at the increase, the percentage change that we are seeing compared to the previous week. And that also determines what alert and what response we do need to trigger.
Is there I mean, do we have a definition of what a first wave or second wave, third wave actually is? If you look on a graph, I mean, do you have a particular percentage increase over a week or a month? Do you have a specific sort of a sharpness or change in the trajectory on the graph that you look at that you would point to and say that's now the beginning of the third wave, we need to take significant action?
Yeah, so while there aren't any formalized or global indicators, what we are using is looking at the peaks of the previous wave. And what we are tracking for a beginning of a third wave is if we see that the moving 7-day average increases above 20% of the peak of the previous wave, we can formally then say that that would be the beginning of a third wave.
We obviously have the big Easter events coming up. I don't know if they're going to be nearly as big as they used to be, maybe a little bit bigger than last year when pretty much all of them were cancelled. But if I remember correctly, before the pandemic, more people actually moved around in South Africa during the Easter period than over the Christmas period. How worried are you about movement during that time?
Sorry, Stephen, the line is breaking up. Do you mind repeating?
I was going to say, how worried are you about the Easter period and the fact that more people are likely to be moving around? We've got school holidays coming up just after that as well.
Yeah, that is the big concern right now, because as we are seeing since the move to level 1 restrictions, 10 days to 2 weeks after that, we saw that the leading indicators started flatlining. We're now moving into the holiday period, Easter weekend, and so that is the concern that there will likely be increased mobility, increased gatherings, and if we aren't vigilant, that may trigger the onset and the spread of the virus. So it certainly is a concern, and we do need to monitor and watch our behavior as well as increase our surveillance for any outbreaks and try and get on top of those.
Does it help to stop people moving around? I realize this is a complicated question. I'm sorry, Dr. Suliman, in some ways it becomes a political question too, I'm afraid. But you spoke about sort of outbreaks in certain areas. Does it help in, you know, as we see the number of cases beginning to move up a little bit, does it actually help to stop people moving around or not really?
So mobility trends certainly do correspond and correlate. I think it's important when there's an increase in there's any movement that the spread. So it's help in delaying spread. I think we also need to understand why still with us and will be remain time. So we can't completely stop the way we live. So I think we need to look at other tools in our toolbox to combat the virus. And particularly I'm referring to maybe more proactive monitoring, maybe rapid testing and rolling out of testing to monitor outbreaks, and then to isolate cases, track and trace contacts. Maybe that could be the best way currently to contain any resurgence and outbreaks.
Dr. Ridhwaan Suliman, thanks very much indeed. Senior researcher at the CSIR. I do appreciate the time. Well.